Okay, so let's continue on with this part. So topic 7, part 2. And let's just look at a specific disease that can happen. All right. So here we go. I think I've got, all right. So let's just have a look here. So if you have a mum that does not have the Rh antigen on her red blood cells, so she is Rh negative. If this person, this woman, has a baby in the womb, and that baby is Rh positive. Okay, so because your genes develop or your genes govern your blood type, you can be a woman that's Rh negative and you can carry a baby that is Rh positive. Okay, that is possible. So that means that the mum, the woman, doesn't have the Rh antigen on her red blood cells, but the baby does. The baby does have the Rh antigen on its red blood cells. Now, this is okay because mum and baby's blood never mix. Okay, so that's what we need to, and when we look at reproduction, you'll see how that kind of works. Mum and baby's blood never ever mix. Now, if for whatever reason mum's blood gets mixed up with baby's blood, that's when things will start to go wrong. Okay, so for example, if mum gets some of her baby's red blood cells into her bloodstream, she, because she thinks it's something foreign, she will make antibodies to kill that red blood cell. Okay? So this is what this picture shows. If you have the baby's red blood cells go into the mum for whatever reason, trauma or whatever, mum will make Rh antibodies. And that's a problem because antibodies can pass through the placenta. Now, some things can go through the placenta and some things can't, but antibodies can. So mum will make antibodies to kill the Rh positive red blood cells. And this is not good because those antibodies are going to go into the baby and kill its red blood cells. All right? So that's the issue. Now, what happens in order to, if that does happen, you know how you go and get blood tests when you're pregnant, they can work out what blood type you are. If you do have antibodies for the for anti-D, so the D antigen, what they do is they give you an injection to stop you from making those antibodies. So you can get that injection and the mum stops making antibodies, and so that means that the little baby's red blood cells will not be attacked. Okay, so that is the whole point of that. So the mum is Rh negative, the baby is Rh positive. If an Rh positive cell goes into mum, mum is going to make antibodies to kill it because according to mum, that is a foreign cell. It doesn't belong to her. She's going to kill it. Okay? And so mum's antibodies go through the placenta and then will kill the baby's red blood cells, and we can't have that. Okay, so she's given medicine to stop this from happening. And don't forget that anemia, the definition of anemia was a problem with your oxygen transport. Okay, right, so let's move on. So we know that in our blood is made up of plasma and formed elements, which are cells and bits of cells. We just had a look at our blood typing, but now let's just have a very, very quick look at our leukocytes. So white blood cells are called leukocytes. And and we have 5 different types of leukocytes in our blood floating around. And as I said before, we're going to look at exactly what they all do when we do the immune system. Just to be kind of understand, you have like the most number of leukocytes in your blood are your neutrophils, and then never let monkeys eat bananas. So this is the relative abundance of each leukocyte in your blood. We're going to learn more about the function of these, and just with regards to their anatomy, some leukocytes have granules in them and some of them don't. And this is, if you have a look at this picture, you can see, look, that one, the nucleus looks really weird. Look at that nucleus. It's weird. Look at that one. So their nucleus is not round all the time, and they have granules. So this one doesn't have any granules. These 3 do. These 2 don't. So leukocytes, the nucleus looks funny. Some of them have granules and some of them don't have granules. And then when we do the immune system, I will just tell you or teach you why they have those granules and what those granules do. Okay. So just so you know, just to recap, I mean, we're getting to the point in the subject where we kind of are seeing things over and over and over again, which is great. So just to make sure, recap, we know where our blood cells come from. They come from red bone marrow. So in your bone marrow, you've got a stem cell that can turn into this guy or this guy. If they turn into this guy, it can turn into this. So this, or this, and then this guy turns into this. If you go this way, if this stem cell turns into this guy can become this, or this. This becomes this or this, and this, platelets, are just pieces of this big guy here, the mega. They're mega. So that's what a platelet is. So just look, this one's got granules, this one's got granules. That one doesn't have granules, that one has, that one doesn't, okay? So just be aware that this is where the cells that live in our blood, this is where they come from. And it's all related to this guy, this stem cell, because he can become any of them. So let's just do a bit of a clinical link. So how does this, just to get it into our minds, how does this apply to us? So leukemia is cancer in your bone marrow, which means that these cells are dividing, but dividing uncontrollably. So they're doing too much mitosis, and what they're becoming is not what they're supposed to be. So they don't work. Okay. So so your bone marrow, and let's have a look and see what you look like, what your blood looks like if you had leukemia. So this is what your normal blood should look like. You've got your little platelets, so these guys here, You've got monocytes, they look good. Your lymphocyte looks good. Your eosinophil looks good. Your, what's this guy? Your neutrophil looks fine. But if you have leukemia, the cells that your bone marrow are spitting out are, they're either the wrong shape, or they're not enough of them, or the ones that you spit out are wrong. Like they just don't function, or they're abnormal. So let's have a quick look. So if you have leukemia, look, you don't have as many red blood cells. Your platelets are still okay. But look at these. You end up with lots of these, which really shouldn't be there. Your monocytes, you end up with too many of those. You know, your neutrophils are weird. They're coming out, but they're not right. You know, and you know they're just weird. Okay, so just to be mindful of that. Just that's what leukemia is. All right, that's it for that part.